So next, I just want to briefly turn our attention to a review we've also published this year in Faltering Growth. Again, looking at oral nutritional supplement benefits. You'll see some similarities and some differences as we go through the data here. So again, the aim of this review was to systematically examine the evidence from randomized controlled trials looking at the efficacy of supplements upon a broad range of outcomes in children who present in clinical settings with or at risk of faltering growth. So it could include papers from children aged from 1 to 18 years. They had to be at risk or have faltering growth and recruited from these clinical settings. So that included hospital inpatients, hospital outpatients, specialist clinic, general practice surgeries, for example. These individuals had an indication for a requirement for oral nutritional supplements due to their presence or risk of faltering growth. And the faltering growth had to be linked to some underlying disease or the medical treatment of that disease. Again, we only included randomized controlled trials and full papers. And similar to the other review, we looked at multi-nutrient ONS. And they could be consumed across all settings in this systematic review. So surprisingly or not surprisingly, I don't know which way you would think, but there were many less studies in paediatrics than we find in adults. So over 11,000 studies were identified, and we looked at the full text for eligibility in 60. And actually, we only found 10 randomized controlled trials that were deemed to be eligible to be included in this review. So a much smaller number of studies were available to be analysed compared to the adult population. And this, we were looking at all outcomes as well, whereas in adults, we were just specifically looking at complications. So this was a really hard review to look at in terms of the extraction of the data. So much of the main review is narrative in nature, and there were a few key elements that we were able to meta-analyse, which we'll go on to consider in a moment. So overall, there was 1,116 children within this review, and the weighted mean, so the average age of the children was 5 years. Yeah, and so the indication for ONS was low weight, included obviously faltering growth, and all the different types of conditions. So 2 of them received ONS as inpatients and 8 RCT received ONS at home. And you can see on this slide the types of patients that included, so cystic fibrosis, malignancy, burns, infections, and picky eating, for example. So the mean prescribed intake was 412 calories per day. Again, the majority were using ready-to-drink supplements, and the intervention period was for around 116 days. So we'll now just look at the meta-analysis as we did before. So we'll turn our attention to the forest plots. A little bit simpler to see, hopefully, because there's much less data to be analysed. But what we found was that supplements significantly improve weight versus control in children with or at risk of faltering growth. Differently to before, we're looking at the difference in means here, so the difference in weight between the 2 groups. And what we found is the difference in means was 0.4 kilograms. This was significant, and so we found this significant greater increase in weight with supplements versus a control. We were also able to have enough data that enabled us to look at height, and we found that ONS significantly improved height versus control as well in these children with or at risk of faltering growth, with a difference in means of 0.3 centimetres, which again was significant. As I mentioned, much of the data in the review, if you look at the full paper, is narrative in nature. So we'll now just look at some of those outcomes in terms of nutritional status and other clinical outcomes that we were able to review as part of this systematic approach. So for example, 6 RCT reported total energy intake. Statistically significant increases in total energy intake with the supplements was found in 4 of those 6 RCT. There were no significant differences between the groups in 1, and significant increases amongst the ONS group was also found in 1. So you can see here it's quite difficult to summarise the data because the outcomes are being measured in different ways in different papers. But hopefully it gives you a good overall assessment of the data. We're also able to look at appetite, for example, in 4 of the studies. 3 looked at appetite scores and 1 looked at ghrelin concentration. There was no significant differences between the groups in appetite scores for 2 of them, and significantly better appetite in those that were randomised to receive supplements in 1 study. And the levels increased in the ONS group only, also in 1 study. And then if we turn our attention to some of the more clinical outcomes that were part of the papers involved in this systematic review, we were able to pull some information around infections and illness in 4 of the studies. So for example, we found significantly lower upper respiratory tract infections in the children receiving the ONS, and that was in 2 of the studies. There was also fewer bacterial infections with the ONS in 1 study, but there were no differences between groups in the incidence of illnesses also in 1 study. So you can see here again, this is a narrative summary of the data, but overall, when you look at it, we are seeing trends towards improved nutritional status and outcomes in the children that were receiving the oral nutritional supplements. So I guess we looked at compliance in the other study, and we also have looked at compliance and tolerance in this systematic review on paediatrics. So if we consider GI tolerance first, 3 studies looked at tolerance, and they all reported good tolerance among those patients who took supplements. And there were no significant differences between the 2 groups, so between the groups that took ONS and those that took control. Compliance was reported in 6 of the trials, and compliance again was highest with the ready-to-drink supplements. It was around 98%, with a range of 94% to 100%. And you can see the table on the right there actually shows the type of data that we were able to find within the trials that reported compliance. Again, they were all measuring slightly different things in different ways, so we've tried to analyse this in a very narrative way. Compliance was definitely less consistent with the powdered ONS, but there were only 2 trials. So most children, 98% for example, consumed at least 75% of their prescribed amount, and 54% of participants consumed at least 50% of the prescribed amount. So hopefully that gives you some overview of the data in terms of tolerance and compliance. So we'll just now summarise overall the systematic review in paediatrics. So overall, we showed that oral nutritional supplements used in addition to food has an important role clinically in the management of faltering growth. We found significant improvements in nutritional intake and growth, with this overall reduction in infections. We found that mean compliance to the prescribed dose was good. And I guess clinically, we know that ONS, is a useful tool and should be considered in the clinical management of children with various acute and chronic health conditions. I guess we should also think about the most appropriate format, dose and duration to really ensure optimal compliance and the best improvements in outcomes for our patients. So thank you for listening today. As I said, I'm so sorry I can't be there with you. I hope you have a super rest of your evening. I hope you've enjoyed this brief update on the new evidence from these systematic reviews. I guess in summary, it's really important for all of us who work clinically to really think about an evidence-based approach to our care. And this data hopefully adds to that evidence base that we already have. And it really supports you in your clinical practice, showing that what we do with our patients nutritionally really can have a big impact especially in helping to improve clinical outcomes. Thank you for listening today and have a lovely rest of your evening.